Such an important story I want you guys to hear about. Still waiting for permanent residency after 3 U.S. medical degrees, 14 years of service to Americans, including Hoosiers. Dr. Abhinav Singh is a well-respected physician in Indiana, dual board certified in internal medicine and sleep medicine. He's a medical director of the Indiana Sleep Center and a clinical assistant professor at Marian University College of Osteopathic Medicine. It has now been 18 years, still no green card. Dr. Singh joins us live from his clinic in Greenwood. Dr. Singh, good morning to you. Nice to see you.
Good morning, Angela. It's a pleasure to be here.
I want to jump right to this. You're welcome. I heard your story actually from a viewer that said, will you please bring some light to Dr. Singh? I can't believe that you've been fighting for this for so long. What is the issue here?
So it just goes back to rules that are old and need sort of updating, I feel. And, you know, I got here in 2002 and 3 medical degrees, a public health, a residency, went through the ropes, was very fortunate and to be trained in the US with excellent resources. That's what brings us here. People like me come here for exactly that. Quality education, excellent resources, and then serving our American citizens and people for the last 16 years. And then we just, the key word here is temporary skilled worker. And even today, I find myself classified as a temporary skilled worker. And that big lump of temporary skilled workers don't distinguish different fields of work and skill or merit. It gets lumped into one. And that's why we find ourselves sort of backlogged for so long. And if we could reform this, it would solve a lot of the problem, especially now in this pandemic.
U.S. Senator, sorry, I thought you were finished. U.S. Senator Todd Young proposed something here, but it seems like it's not going anywhere. What is the proposition?
So there is an excellent bill which actually helps address this problem. It's called the Healthcare Workforce Resilience Act. It takes about 10 to 12,000 US trained, international born physicians like me who've been working here for 7, 8, 9, 10 plus years. And it takes about 20,000 plus nurses. It gives them the opportunity to apply for permanent residencies and citizenships by utilizing uncaptured visas, which already have been congressionally approved and are sitting there unused. This will allow the flexibility and folks like me to basically, have a path towards permanent residency.
I want to talk about what could happen. I mean, if something were to happen to you, it's my understanding, for example, that maybe your family would be deported. Is that accurate?
That is correct. So every 3 years, I have to renew my temporary skilled worker visa. And it's been 6 iterations almost of renewals and waiting for my turn to come for permanent residency. And if I were to get hit by a car, get sick during the pandemic, as you know, healthcare workers are about 10 to 12 times likely to get sick and exposed. And if I were to not fulfill my temporary work agreement, then my wife faces deportation with my 8-year-old. That's hard, cold fact. It's unfortunate, it's true.
What can we do to help or get out information?
I think awareness. I'm still very grateful to my clinic, to my patients, to the healthcare systems here, the United States. I feel we just need to draw attention to the matter and have a pathway for healthcare workers, such as trained US trained and qualified nurses, US trained physicians, because there is a shortage. 133,000 physicians short is what we will be in about 2030 is what the estimates are. And if we could help this process along, we would probably help this shortage a little bit by drawing attention to the matter.
Well, I hope that this draws some attention and we're able to get the word out. I just want to say thank you, too, for caring about so many people, so many patients in Indiana, and all that you've done to try to help us live healthier, better lives. Thank you for that.
Thank you. And just one last word, please sleep well, because sleep is your immunity. So good sleep gets good immunity to fight against this virus. All the best to you. Stay safe, everybody.
Dr. Singh, I want to have you back on and talk sleep, okay? Promise me you'll come back on and we'll talk sleep.
Yes.
Because we don't get enough of it. If you would like more information.
I promise. Okay. I would love to do that.
Okay, we'll come back on. I'll set it up. If you would like more information about helping Dr. Singh, we'll link you to his petition.